Well, thanks very much, Casey, for that really good introduction and setting the context for how we came to this point of developing this valuation guide. So maybe we'll go to slide 2. I do want to acknowledge that Don Shepard is the champion of this project and has been the lead for us on the Security Knowledge Initiative. And this is a larger project, a larger initiative, I should say, that the evaluation guide sprang from. And that initiative, we began working on it in 2008. And it's pretty well wrapped up our work on that until 2013. But the context and the aim of that overall initiative really help us develop, apply, and test and learn about how to do effective knowledge dissemination and exchange. In particular, we wanted to test the usefulness of the knowledge cycle we developed as part of our best practices work here at the Public Health Agency of Canada, and look at ways to enhance how we can interact with research policy and practice groups to better advance moving from knowledge in terms of
new participant has joined the conference
and knowledge to action. So that was the key focus of that, and we chose to work on food security because it was issues that span across multiple chronic diseases. And so in terms of the initiative as a whole, we really want to look at how can we actually advance work on food security in terms of chronic disease prevention or upstream chronic disease prevention, while at the same time working with people to generate and share knowledge to accelerate effective approaches, in particular relating to vulnerable individuals at higher risk. And so let's move to the next slide there. And the guidance framework that we use, I just mentioned, was our knowledge cycle. We developed this as part of the Canadian Best Practices Initiative, and essentially that is our Canadian Best Practices portal, where one of our key pieces of work is to search for, screen, and post best and soon coming promising practices in the area of health, social, and chronic disease prevention. And we developed this framework to help us understand, based on the literature as well as the PE experts across Canada, what the key processes are that we can be looking at and engaging with a variety of audiences to identify key needs, create knowledge product activity tools, fill gaps, key gaps in practice and evidence, translate those and disseminate them to broad audiences for adoption and use in practice. And the central piece of this is that we're not just trying to look at how we can take published or academic evidence and support its use in practice, so evidence support practice, but also just as important, how can we support practice-based learning where we're actually documenting learnings from the field and adding that to the knowledge base so that we have a much richer set of knowledge to inform all of our actions and to learn from contextualize experiences across the country. So as part of that knowledge cycle work, we began looking into food security, and if you can move to the next slide, please, at through some research and scanning and consultation of food security and chronic disease groups. We looked at what are the key areas that we focus on for action, right? These 4 areas were identified. In particular, creating and exchanging the knowledge, increasing links and awareness between food security and chronic disease, as well as looking at how we can advance participatory community food assessments and food approaches at the community level, and finally strengthening capacity for evaluation. And that's the key piece that this project has focused on, is that the capacity for evaluation. Next slide, please. So the reason that our rationale for focusing on an evaluation guide is that for community food actions, and there's a definition that we provided here around community food actions in the context of food security in general. And as you can see, and know from your own experiences, this can really range and be multiple approaches that focus on an individual, community, or organizational change initiatives, including policy and system change. So one part of us on this track is we said, well, we have a best practice portal. We really want to look for interventions across the country that are best practices or effective practices on food security and chronic disease prevention. And so we conducted a scan in 2009, and what we found, there's of course a wealth of activity happening across the country in the area of food security, but there were very, very few that had been written up and either published in literature or even written up in the grey literature that can be found on organization websites. And so there was very little documentation of what are the impacts, what are the results, what are the lessons learned from these pieces. And we know why. There's lots of good reasons why. Challenges, and that's because people are really busy doing the great work of actually implementing good actions and working with communities and a variety of sectors to do that. And they often have very little time and sometimes limited capacity to do evaluation. What we also found is in terms of what actually did exist, there's huge variability in the quality and speaking to what DP just mentioned before, that different indicators were used, different focus questions, and as a result, what you can say about whether food security actions influence how the chronic disease prevention is needing for them is very limited. So we felt there was really a need to help support generate more of this evidence from the practice that actually happening across Canada and to share progress so that people can learn from each other and better be able to educate or tell stories of impact. Next slide, please. We began in 2009 or 10 to work on the development of this guide, evaluating outcomes of community food action. And we set up a working group that included BC Provincial Health Services Authority, Food Bank of Canada, First Nations and Inuit Health Branch of Health Canada, BC is involved in the development of this guide, Tanya Morrison at Health Canada involved, as well as other colleagues here at the agency. And so we began with that working group. We undertook a literature review to identify some key security indicators should be. We also involved in the Office of Nutrition and Quality Promotion at Health Canada as well, because they're experts on security indicators, and looked at outputs and what the related outcomes for success would it should be. Based on that, then we refined that down to a key set of indicators to focus on for the guide. And also, a big focus for us was identifying resources, practical tools, text, articles, resources that would help and it would be relevant to security evaluation. And then, of course, months and months that can't be quantified, but a lot of time on writing research, consultation, and design. We have feedback on, obviously, from our working group, but then we also engaged with about feedback from local public health units, provincial public health organizations, NGOs, in the area of social and public health, and university researchers. Next slide, please. It was also important for us to make sure that the guide would be culturally appropriate, as well as user-friendly. If anyone has checked out the guide, it's a sizable paper. So it's not a quick and dirty book. But what's really important to make sure that it could reflect different realities of food security and community food action across the country. So in terms of First Nations and Inuit perspective, we did actively involve, as I mentioned, in the development of the guide and in the advisory group. And we also sought and received consultation and feedback from the Assembly of First Nations and IDK in terms of giving us feedback on the draft evaluation guide that was incorporated. And finally, we also tried to include examples of culturally specific case studies and evaluation resources that would be relevant to Aboriginal health. And I believe that we're working with PHAC to do another session coming up, another webinar that will help us highlight other, particularly for Aboriginal communities, other evaluation challenges in the area of security or other resources that may be available. And so you may look forward to that in a few months' time. And finally, then we also pilot tested or field tested the guide, the draft guide in particular in BC, but also it's been shared quite extensively in New Brunswick, primarily at the health authority or community level. And the focus there was to test the accessibility of the guide that work in different contexts, different food actions. And the feedback was that it was a valuable resource that could be used in a variety of settings. We also want to make sure it was easy to use, and the feedback that we received is that it has accessible language and helpful examples and very comprehensive. And we've incorporated those changes into the final evaluation guide. And one piece of feedback that we have also got was, boy, that's really big, and there's a lot there. And it's true. You can think as much or as little as you like from it. So happy to receive any additional feedback and comments you might have. Next slide, please. So I thought I'd spend just a couple minutes to go over the guide. Just highlight some pieces from it. First, it's not just a general evaluation framework. It really is a pretty and in the context of food action. And it really is for people that do have some familiarity with evaluation methods and thinking about process versus outcome evaluation. At the same time, it's by no means for those who are experts in evaluation or self-evaluation themselves. And some of the feedback we received from users in terms of their testing was that despite the fact that we have a lot in it, actually it can be used by people who are sort of just starting out in terms of community food action and evaluation. In terms of what the focus is, obviously to provide some practical tools and resources and strategies to evaluate outcomes, but also reflect on process changes that can help continuously improve the work that we're doing. And in terms of what it includes for 4 key steps in evaluation, the first is really around planning and thinking about community food action that you have and how, what it's designed to try to achieve. Really honing in on what are those objectives and what is the focus and priority. Second key step is around gauging participation in asking the evaluation questions and engaging with stakeholders and partners or participants that focus. The third step involves gathering actual evidence about outcomes and learning. And then the final is around analysis and communication. The focus of evaluation outcomes, next slide, thanks, is that we've identified this range of outcomes, and it really speaks and mirrors to key pieces of success that you highlighted earlier in terms of how we can think about the impact that action can have. Obviously, they can have actions on the immediate things that we may think of in public health in terms of knowledge and skills. But also from beyond an individual perspective and individual changes, we can also look at community level changes in terms of food availability and affordability, food access and consumption, which can be both individual and needs. And then from more so organizational or larger community perspective of awareness and partnership, opportunities to leverage resources from other areas. We went back to fund there for a minute. And then the final area is around system change. And we're going backwards by accident there, Bill. So in terms of system change, obviously that we know in public health approach to be effective, we need a comprehensive approach that will look at individual, community, organization, and policy change, not just in awareness and knowledge, but in terms of funding, initiatives, policy changes, environmental changes that can increase affordability and access to food. Just have a couple more slides here, and I think we'll focus next then on the stages of the guide in terms of what's actually in it. The next slide, please. And actually, one piece that's not in the guide, but it comes along with the guide, because if you are a real evaluation geek, so to speak, and some of us are here, then we have a companion document that's called the Measurement and Analysis Companion Document, and it has a lot more resources and a lot more information to really support analysis for community food action work. So if you think that this is something that's of value to you, please do want to learn more, please go to that companion document. And both pieces are hosted right now at the Convention Alliance of Canada's website. Right on the front page, there's a link to the evaluation guide and there's a link to access to identity courses. Within the guide, we also have a focus on thinking about what the uses of evaluation are, why we do evaluation, and we spoke to some of those in terms of coordinating decisions around continuing program action or activities, coordinating applications for further resources to add to what we have anything, do that, add to our effort. And then as well, things like what we really advocate is continuous improvement, so learning along the way, a continuous ongoing evaluation approach that we can learn, feedback, and reflect and change as we go. And so depending on the different audience for evaluation, you might want to focus on different questions so the guide showcases a bit of that. And in particular, because of the nature of security and the vulnerability of populations that are affected by it, it's important to consider a participatory evaluation approach. And the guide talks about the level of participation, level of involvement of different groups in order along that participatory evaluation. The other key piece that the guide includes is present a food security evaluation framework and also allows you, through the use of various worksheets for planning, to build an evaluation approach tailored to your community food action program. It builds on that framework. And it all really draws on best practices in evaluation. So next slide. I'll try to close by one piece here by talking a bit about the dissemination and use and feedback of the guide. As I mentioned, CDPAC has been a really great partner with us in terms of helping to disseminate the guide, post it on its website, and help us support tracking of it. So through both electronic means and targeted dissemination as well as listservs and other mechanisms. So the guide has been disseminated across Canada to a wide variety of areas, both food security and chronic disease prevention as well. In terms of what we've seen so far, and actually the data is a little bit old from last year, but in terms of websites, we've seen several thousand people viewing and going to the sub-pages of the site, and we've had over 500 people download the actual guide itself. Over 700 today, sorry. Thank you. And what we see is in terms of who is downloading the resource, that it really ranges from local, provincial, and international level, and from people that are in both public health and secure community organizations as well as in academic research labs. So a wide variety in terms of the audience. And some of the feedback that we've received is that regardless of the type of the community food action, whether or not organizations were at an early or further developed stage of development and implementation of their initiatives, that this guide was felt to be really a resource to their work in a number of ways. Perhaps even at the front end in terms of planning an intervention or a program, think about what should be included and what pains are, as well as obviously through ongoing evaluation and more summative evaluation. As well, we received feedback that the guide was really written and provides good examples. So I think I will leave it at that and say that we welcome your questions or comments. Obviously, email me. You can post comments or questions on the chat pieces here. And as we go through the applications, then at the end we'll have time for a discussion. Just we can flip to the last slide there. Thanks, Bill. going to acknowledge the work of Don Shepard, Penny Morton, here in Health Portfolio, Government of Canada, as well as our project working group members.